Sharon, thanks for speaking with us. How long have you felt unwell this time?
For 4 weeks.
And can you tell us when you were first diagnosed with Graves' disease originally? About?
A year and a half, 2 years ago.
And what's your age now?
42.
And you had a period of treatment and you came under control with medication to start with.
Yep.
So you went into remission, then you had a relapse, and now you've become unwell again. In the 4 weeks that you've been unwell, what have you noticed?
Stomach cramps, vomiting and diarrhoea. Can't really keep anything down. My ears are blocked, my nose is oversensitive, like with food, the smells of food, and just really lethargic.
With the diarrhoea, is it frequent loose motions? Or how would you describe, how many times a day do you normally go to the toilet when you're well?
For a bowel movement, I'm lucky to go once a day with a bowel movement.
And what about now?
5 or 6 times a day.
Okay. And is it firm or soft or runny?
It's bright yellow and runny.
Okay. With the breathing, you seem to be having some difficulty breathing. What have you noticed with that?
As long as I don't move, I'm okay. But once I get up and walk around or have a conversation, that's when I find it really hard to sort of get my breath.
And have you experienced any palpitations?
I'm not sure if I sort of know what they are, but I know if I've walked down, like to kiss my son goodnight and I sit back on the lounge, my heart, I can feel my chest really sort of going boom, 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 boom.
Mm-hmm.
So if that's what it is, yes. But
and have you noticed whether that's regular or irregular?
I'm not sure what I'm looking for in that sense.
Well, if you think of a drum beat,
yep.
where a drum beat is going in a nice regular pattern, even if it's fast, or is it all over the place?
No, it's all over the place.
We've checked your pulse and the pattern is called atrial fibrillation, and it's going rather fast at the moment. It's about 160 beats per minute, where the normal pulse rate is between 60 and 100, and it's usually regular. And the last time I saw you when you were well controlled, your pulse rate was 78 beats per minute and it was quite regular. So things have changed quite a bit. Are you aware of having lost weight?
Yeah.
What have you noticed?
About 2 weeks ago I got on the scales at home and I was 68. Last Friday when I had a blood test I was 67.
Mm-hmm.
And then today, whatever it was today, so...
Today was 67, so you haven't really lost that much.
Okay.
Have you been aware of the swelling in your neck?
That's always been like that?
Yes.
So...
I wonder, I'll just come from an angle so that we can show the diffuse enlargement of that gland. And we can see that you've got a diffuse swelling in the neck. Your doctor thought it was nodular, but in fact that's just the shape of your neck and the parts of the gland that are enlarged. But that's called a diffusely enlarged gland. I'm going to just zoom in on that so the students can see it a bit better. And it's quite easy to see that that's enlarged generally throughout the gland. Another interesting thing is that your eyes, you have what's called a thyroid stare, but you don't have thyroid eye disease. So that's good because we don't want the thyroid eye disease. Could you look up at the ceiling, please? Could you look down? Look straight ahead, look to the right, and look to the left, and look straight ahead again. That's fine. Have you noticed any weakness of your arms or legs?
No.
Have you had any difficulty getting up out of a chair?
No.
All right. I'm just going to come up to you and see if we can check your strength in your upper limbs, and then we'll do the same in your legs in a moment. If you could hold your arms out to the side, please. And I'm just going to try and push you down. Hold them up as hard as you can and don't let me push them down. Now you're quite strong because you're very fit and you work out a lot. Okay, normally I couldn't do that to you. Let's just try with your legs, if you'd like to lie back. If you could just lift this leg up, hold it up there, and don't let me push it down. Alright, and this leg, don't let me push it down. Okay. Ordinarily I don't think I could overcome you because you're quite strong. I'll just rearrange the camera and we'll demonstrate your reflexes. Can you see your arm, not me? Good.
Yeah.
Okay, thank you very much. I'm just going to zoom in again. And I might ask you just to sit up a little bit higher, please. And I'll have to adjust. Turn your head away from me slightly, if you would. And that's demonstrating atrial fibrillation in internal jugular. You can see the elevation of the jugular venous pressure, and you can also see the atrial fibrillation waves.